Welcome to the Our Work Matters podcast of the Florida Developmental Disabilities Council. If you are an individual with an intellectual or developmental disability, their family member or caregiver in Florida, this podcast is the place for you. The FDDC's purpose is to promote policies and best practices for the IDD community through education, advocacy, and partnerships. In this podcast, we'll be sharing ways you can get involved by highlighting our partner projects, legislative platforms, and advocacy opportunities. So come learn more and join our community. I'm so excited to share with you today the work that our guests are doing for people with intellectual and developmental disabilities, or IDD, and for their families and caregivers to help them better advocate for themselves with case management and residential settings. I'm here with Diane Beaver and Alex Kobrin, our research partners from Mathematica, Inc., and they have developed some really amazing tools that I think you're really going to want to hear about. So if you guys can get us started by telling us a little bit about each of yourself, we can start with Diane.
Hi, it's great to be here, Chris. Thank you so much for having us. My name is Diane Beaver, and I'm a managing consultant at Mathematica. My job primarily entails working with policymakers at the state and federal level to ensure that they understand the experiences of real people before they're making policy decisions. Before joining the team at Mathematica, I spent 11 years at a community-based organization in Maryland, overseeing publicly funded programs for people with disabilities, including employment services and benefits counseling. During my time in the nonprofit sector, I learned a lot about the challenges that people with disabilities and their families face when they're just trying to get their basic needs met by an overly complex, oftentimes fragmented system. And, that really has driven a passion in me about ensuring that people are getting well-coordinated access to the services and supports that they need. And I've been, for the last almost 2 years now, been working with the FDDC on some projects, and I really have been enjoying that work because the projects that FDDC is sponsoring really target what people need and making sure that they have access to the services and supports, and they are aimed at solving complex service delivery challenges.
Alex?
Sure. My name is Alex Kobrin, and I'm a survey researcher at Mathematica. And I have quite a lot of experience at this point working on projects serving individuals and families with IDD. And this is a topic that I'm really passionate about because my brother is a person with a disability. So I'm really familiar with many of the challenges and nuances surrounding receiving services. And I really love working on projects like the one we're working on with the FDDC to help create resources that will hopefully make the process easier and less confusing for individuals with IDD and their families.
Let's start with the residential tool. Alex, can you tell us a little bit about the tool that you've created and what it aims to accomplish?
Sure, happy to. So the residential tool is designed to help tool users determine whether a residential service provider might be a good fit for them. There are two versions of the tool. We have a long version and a short version. And both versions cover a broad range of topics and give tool users questions to ask the service provider. So the long version of the tool provides many suggested probes that users might ask a service provider. And then the short version actually sticks to more high-level questions, and it has some images within it and easy read features. And we do make it clear that the residential tool isn't the only resource that people should use to evaluate a service provider, but it is one potentially really helpful data point.
So is this something that they would use when they go to look for a place to live? How would they ask questions? Would they do observations, or both?
Yeah, so we expect that people would be using the tool both to evaluate a provider that they are currently living at or to evaluate a new provider. So we hope that it's going to give users a bank kind of for lack of a better word, a bank of questions to ask, as it can be really hard to remember all the things you want to ask when you're in the moment visiting a service provider. So, we kind of expect that individuals with IDD and family members or caregivers would be the most likely to benefit from using this tool. And then we also think that residential service providers themselves could potentially use this tool to score themselves and see where they might be falling short or where they can work to make improvements. But I did want to note we are planning to create a service provider specific version of the tool later on. So the current version that we have right now is intended for individuals with IDD and their family members and caregivers.
That's awesome. I have a sister with a developmental disability and mental health issues, and I know that that is something that would have been really helpful. She's older than I am. In going and looking and trying to decide what a good placement for her or what a good site would be for her. So I think that's so cool. Diane, can you tell us a little bit about the case management tool and how that one works?
Of course. So there's a well-known problem that there really aren't consistent performance standards for case managers or people who do case management like tasks, like people like waiver support coordinators or early step coordinators. So most of the tools that exist in the world right now related to case management really are compliance-based. And so they're going to ask and measure things like, does the case manager do a care plan? Or did they put their notes in on time? Or how is billing going? And what we found in our research is that those things don't really matter to people. And the things that people really care about with case management are, is my case manager a trustworthy person? Do they talk to me in ways that I like? And so we wanted to create a tool that really captured those aspects of case management and not the compliance-based issues with case management. So a couple of years ago, the FDDC started to work with Mathematica, and the objective was create a tool to set expectations for case manager behavior. And we wanted to create something that would be agreed upon both by people who provide services as well as those who receive them and their families. And so we have since developed the Working with Case Managers Guide, which is now something that can be found on the FDDC website and that you can access and learn a little bit more about case management.
And again, I think that's another really good tool because I think a lot of individuals with IDD really struggle with first knowing what they can expect and what they should expect, and then in communicating that to other people. I think that is a piece of it that is really important. So you mentioned that Mathematica and FDC developed a partnership. Can you talk a little bit about your process, either one of you, about what goes into creating a tool like this?
Basically, we've put a lot of time and thought into making these tools the best that they can possibly be. Even though we developed tools on entirely different topics, actually the process was pretty similar for developing them across the tool that Diane was just talking about and what I was just speaking about. So we began by conducting some online research to see what kinds of resources were already available out there. And we used the background research that we conducted to draft tools that we then shared with Sue at the FDDC, as well as a group of people who have personal or professional expertise around the topics to gather their input. And we call them a work group. We've been meeting with them on and off over the past couple of years. And so this past spring, we also conducted testing of the tool with a pretty large number of potential tool users. So, individuals with IDD and caregivers or family members to get even more input from them on how we could make our tools better. And we used all of that feedback that we've been receiving over the past year and beyond to refine our tools. And we had them professionally edited and formatted so they look all nice and polished. So yeah, that's the process that we've been going with. And we're always continuing to refine our tools as we get new information.
Yeah, I think one of the things that I really heard you say is really
is more than just like, we thought these were good things, or this is what the literature or the standards are for what they should be doing. And you really were getting input from people who are dealing with this on an everyday basis. And I think that piece of it is one of the things that makes it so valuable, is that you've really incorporated input from individuals with disabilities and their families and their caregivers, as well as professionals in the field. Because I think so often we have things in our field that it's like, well, the professionals decided this is what you need to do. And we sometimes leave out the people who actually are the ones that are affected by it. So I think that process that you have is a really, really strong process for developing tools that can be so useful. Tell us a little bit about Diane, tell us a little bit about how they would use the case management tool. Like, what exactly would go into that process?
Sure. So when you are looking at the tool or using the tool, there are a few components that you're going to interact with. The first is a list of the key skills that we think a case manager should have. And this is a very simplified, plain language list of 19 items that are things that you really should be able to expect of a case manager. So that's one component of it. The other components of the tool are what we're calling user surveys, which probably means nothing to this audience, but think about it like it's like a BuzzFeed quiz of some sort, where we designed a quiz for a person with IDD to take, with statements for them to think about their case manager. So, for example, one of the plain language skills that we have is, my case manager is someone I can count on. And in the survey, we have a sentence then that is, on the survey, there will be a sentence that kind of correlates with that idea. So we have one version of the survey that is designed for a person with IDD. And what's, I think, really cool about it is that it's plain language. It has easy read features. It uses AAC images to try to help enhance understanding. And when we did our research, what we found is that some folks with IDD really weren't comfortable using the tool on their own. But when they had a caregiver support them, they were able to use it and able to evaluate their case manager. And then we found other people were perfectly comfortable using it. In addition to the list and then the survey for people with IDD, we also have a caregiver version of the survey, which is the same ideas, but it's just catered towards the caregiver. And what we realize in the case management relationship is that the case manager has a relationship with the person with IDD, but they also have a separate and perhaps different relationship with the caregiver, with the person with IDD. And so we wanted to make sure that we had an opportunity for the caregiver to provide feedback as well, but didn't want it to replace or be in lieu of the person with IDD. So they have their own version of the survey. The questions are geared towards their perspective, and it might ask about things that they observe the case manager doing with their loved one with IDD, or it might be about how they feel about their interactions with the case manager. And so I think that that's a really powerful complement to the tool. The final component of the tool is, once you fill out the survey and you have sort of your idea of how your case manager is doing, you identify kind of which things you really like that they're doing and the things that you think that there maybe needs some improvement with. We then also give some instructions on how you could interpret your feedback and use it to start a conversation with your case manager. And so I think that that is another really valuable component of the toolkit, is that it doesn't just leave you with, here's your results, what do you do now? It really tries to guide someone with a disability on their next steps.
It really helps them learn how to advocate for themselves so that they are able to take action, but also so they're learning good strategies for how to take action in a way that is going to be more successful.
That was one of the biggest pieces of feedback we got when we were doing the testing of this. People were excited by the content, but their question was, so now what? And what it made us really understand is that thinking about the experience of a caregiver or a person with IDD, if you're dissatisfied with your case manager, having information that you're dissatisfied about your case manager doesn't add anything to your life. So we did additional research to try to identify what a process should look like for giving case managers feedback. And interestingly, we found that there's not a lot of resources out there that are geared towards people with disabilities and how they can provide feedback to people in their support systems. I think it's really telling because when you are receiving services, often that might be funded by insurance or by Medicaid or some other government institution. You're not necessarily in a position of power where you feel like you can just tell them what to do. And so, I think it can be really challenging to provide feedback because you don't want to hurt a relationship of someone who's supposed to be helping you. And so we looked at a bunch of different resources and put together a combination of interpersonal communication strategies, along with how you might give feedback in a professional work environment, to how you might ask questions and ask for information from a doctor or a medical professional, and sort of tried to synthesize all that together so that there's really just step-by-step instructions of how you might want to, what feedback you want to give, how you may want to frame and set up that conversation, and then how you can agree on action steps after the conversation that can lead towards change. So we really hope that we've created something that can can lead people towards productive conversations and get solutions and hopefully have better interactions with case managers if there are problems.
And that's so important because I think that is an area where people sometimes feel hesitant to tell somebody like a case manager that they don't like something, because what if they say, well, that we just won't provide that to you anymore, and they don't know how to go about it in a way that's going to be productive. So I think that's amazing. Mm-hmm. And Alex, you had mentioned that you were working on tools for the staff to use themselves. So that might kind of fit into that category a little bit as well, not necessarily the advocacy piece, but really helping them see this is what we're trying to do for our clients who are coming to us.
Yeah, that's right. We haven't developed the tool yet, the version of the tool yet for, the actual service providers to use, but we're working on that as a next step. And we do hope that, it's going to help people who are actually working at, at the service provider to make sure that they're checking, not just checking the boxes, but providing the things that they should be providing and that people actually want, and giving, the best level of care that they can possibly provide to recipients.
That's amazing. I think both of those are really amazing tools. Dan, you had mentioned that the Florida has a scorecard that's called the Clarence. Is that correct? Am I pronouncing that correctly?
Yeah.
Florida scorecard for waiver support coordinators. What exactly does that tool do, and how is your case management tool different?
Sure. So Clarent is a contractor that works for Florida's Agency for Healthcare Administration, or AHCA, and they are tasked with providing quality assurance for the state's developmental disabilities service system. So for those of you who aren't aware or don't have a waiver support coordinator, you can go to scorecard.apd.myflorida.com and you could select your county, and then you could look up all of the waiver support coordinators that are employed in that county. And you'll see things like those coordinators' level of experience, who they work for, and then you see some more interesting data like how many violations have they had, what their client satisfaction scores are. And so my understanding is that if you work with a waiver support coordinator, the agencies for persons with disabilities will invite you once a year to log onto this website and complete a short survey about the waiver support coordinator. I think that our the tool that we developed for case management differs from what Clarent is doing in a couple of really key ways. First, Clarent is only for waiver support coordinators. So, and while we've really tried to design our tool to be used for case management professionals across service settings. So, we have validated it for waiver support coordinators, for people who are employed in early steps, and for people who work at managed care organizations providing case or care management. Second, Clarent's mission and tools really aim at compliance-based measures, which I mentioned earlier are kind of the standard right now in the case management field because it's easiest to measure. You can measure the number of violations. That's really quantifiable. Whereas what we're trying to do is measure what we call quality measures for case management and really aim at the things that maybe are a little bit more subjective, but are the things that really matter to people more. Third, I think, and most importantly, I think Clarent's tool really is designed more to collect feedback from people receiving services and use that as like a measurement, where really the aim of our tool and the reason why FDDC started this work was to really educate people about case management standards and to be able to have those established across the board. And our tool really has that aspect of encouraging self-advocacy to improve case management relationships. So I think they just really serve functionally different purposes and, do different things, all for the aim, though, of trying to improve case management, though, in the state.
Well, and it almost seems like if you've got a system in place to improve that quality, then hopefully those scores of violations would go down and people could also be more successful, which I think is one of the things that's really difficult. Case management is a really, really hard thing to do. And it's something that is always short-staffed. And so anything that helps improve those relationships, I would imagine, would make that a much more productive career choice as well as more productive for their clients, which I think would be awesome.
I hope. One thing I haven't mentioned and that I think is important is that our hope in articulating these case management standards isn't just to educate people who receive services, but again, to provide clarity for the people providing services. In a past life, before I worked at Mathematica, I used to supervise direct service professionals who were community-based workers. And so, what I learned in 10 years of supervising others is that no two people do the job the same. And it's really difficult to give every case management professional similar expectations of what they're supposed to be doing. And so my hope is that by all the work that we have done to interview so many people and hear so many perspectives of what matters, that we've really boiled it down to the core of this is what a good case management relationship should be like. And it's something that's easily agreed upon, that if people do keep that in mind and make their decisions with these sort of, core competencies or skills in mind, then there will be more clarity and more consistency in case management. And it won't feel like such a, I feel like right now it really could feel disjointed when you have one case manager who agrees to do a certain set of things or behaves a certain way, and you transition to a different case manager who perhaps has a different understanding of their job.
And I would imagine you'd see the same thing in residential settings as well, Alex, that sometimes I actually know some of the research in that area, where, a client behaves differently or gets along with one member of the staff or a few members of the staff and not with others, because a lot of it has to do with they just do things differently. Is that something that your tools can help to address in that way? And also to give the client some ways to share, I really like it when you sit and have coffee with me. And, before I have to go to work, that's time I like to spend with you, kind of thing.
Yeah, definitely. I want to note that. So there's a number of different topics within the residential tool. And the point of the tool when people use it is to kind of go in and ideally, if they have time before they actually, meet with the service provider, they will highlight things that are most important to them. So especially in the long version of the tool, there are just so many questions. You're probably not going to get to all of them in the course of whatever length of conversation, maybe it's an hour, probably max that you're going to have with a service provider. So, people ideally will go through beforehand, highlight things that are important to them in particular, and then try and ask those questions of the service provider when they're there at the visit. So I think that hopefully that can really help, potential recipients of services to actually understand whether the service provider is going to meet the needs that they specifically are hoping to have them meet. Same thing goes for caregivers and family members that also might not be, they might not have the same exact goals as the individual with IDD, but they might, want to make sure that, like, for example, they're really, really want to make sure that finances are organized in a certain way. And that might be really important to the family, might be less important to the individual with IDD, or vice versa. It really just depends on that individual or those individuals. So yeah, I think the topics that we've included, as I mentioned, we have financial, we have like health and safety, we have things like communication, social aspects and relationship building and stuff like that are all topics that are covered within the residential tool. So people can kind of pick and choose what they're most interested in talking about with the service provider. And hopefully they'll be able to kind of get into the meat of those discussions based on, the questions that we've kind of laid out for them to ask.
And I love the fact that it's not a one size fits all. There's a recognition that everybody's needing something different, which I think is so important. That's really great. So can you tell us when these tools will be available, how people can access them? I know when we're recording this that I think they're just going up on the website. I know the case management one is going up on the website. Is the residential one as well?
The residential one isn't up on the website yet. We're planning to have it up around spring. Well, I guess by the time that this is recorded, it should be up on the website. So that's the goal. And we're aiming for it to be initially a paper version that people can print out. And then we're also hoping to develop an online version that people might be able to fill out, say they go to multiple different service providers, they fill out this column for this service provider. Now they can do a direct comparison with this other service provider. So they can really see the responses that they got from each of those and see, okay, where does this one, in my opinion, for my needs fall short? Where does this one really match what I'm interested in? So that's another future goal, hopefully not too far out, but at least initially in the spring of 2025, the paper version will be ready.
So by the time this goes to air, I think that both of them probably will be on our website, and listeners can find it at fddc.org. And if you want to get more information about tools like this, or if you want to let your voice be heard and let us know what kinds of things you are interested in seeing developed in the future, definitely make sure that you sign up for our newsletter, where we'll share opportunities to participate in some of the research, like the research we talked about here for these measures, as well as for our 5-year plan and things like that. So that's fddc.org. We'll make sure that's in the show notes. And I'll also make sure I get information about both of our guests today. I really want to thank you guys a lot for being here today and sharing what I think is really amazing work. Again, as a family member, it's something I know that will be very, very useful for a lot of families and individuals with IDD. And I know that we have a lot of people out there that will benefit from that.
Well, thank you for having us. It was a pleasure being here today.
Thank you. And hopefully we'll see you next time.